It's Rick and Sasha with George Wilborn. You know, we always got a special guest here. Sasha?
Yes. Her name is Dr. Nicole Lee Plenty. She's double board certified OBGYN. She's brilliant. And if you don't know, it's Pregnancy and Infant Loss Awareness Month. Good morning, Dr. Nicole.
Good morning.
Good morning. Thank you guys for having me.
Thank you.
You know, a lot of people saw what John Legend and his beautiful wife, Chrissy, just went through, and it was the loss of their baby. And it touched many, many people around the world. What are some of the causes of miscarriages in women?
Yeah, I think that Chrissy Teigen's loss and how she highlighted it so openly was amazing because it allowed a lot of women to explore the things that we've gone through and the losses that we've had. So everybody's situation is unique, but some of the causes are people can have chromosomal abnormalities, meaning their baby may have an extra piece of chromosomal material or genetic information that's just not compatible with life. But even those syndromes that are compatible with life still have a higher risk of stillbirth. Some may have bleeding complications. So if we followed Chrissy Teigen's story, we knew that she had a lot of bleeding during her pregnancy and she had blood transfusions. So it could have been a problem with the afterbirth. So that is a risk factor for miscarriages. And then medical complications. So if you have uncontrolled diabetes or high blood pressure, or if you're morbidly obese, that puts you at increased risk. But most of the time, we have no idea why people have miscarriages. Half the time, we don't have a reason.
Doc, being an OBGYN, I mean, which side do you choose? I mean, especially thinking about the mortality rate. The OB side, the GYN side, which one do you favor most?
Well, you know, I practice maternal fetal medicine. So I am only high-risk OBGYN is what I do. So I do some gynecological care, but mostly OBGYN and on the high risk side. So I diagnose fetal anomalies. If there's a problem in a pregnancy, then that patient is referred by a general OBGYN to someone like me to try to figure out what the problem is. I manage patients with cancer in pregnancy, heart disease in pregnancy, uncontrolled diabetes in pregnancy. So I am definitely more so the OB side.
Gotcha.
How has it been going with COVID and women delivering their babies? Are the fathers allowed in? What is put in place to protect, everybody?
It's Rick and Sasha with George Wilborn. Dr. Plenty, I want you to answer that when we come right back. We're talking to Dr. Nicole Plenty about Pregnancy and Infant Loss Awareness Month. We'll continue that conversation shortly. It's Rick and Sasha with George Wilborn. It's Rick and Sasha with George Wilborn. We're talking to Dr. Nicole Plenty, double board certified OBGYN, about the recent infant death of John and Chrissy Legends and COVID delivery.
How has it been going with COVID and women delivering their babies? Are the fathers allowed in? What is put in place to protect, everybody?
Yeah, Sasha. So initially, before we knew, and we still don't know a lot about COVID-19, but before, no, I mean, moms were delivering by themselves initially in March and April, and people would be allowed to come and see them, but they had to have almost like a hazmat uniform on to see their child. Now, moms are allowed one visitor. If the mom is COVID-19 positive, then the dad or whomever their one visitor is would have to wear an N95 mask, wear a hat and a gown to protect themselves if they're negative. Obviously, if they're positive, they are protecting everybody else that comes in and out of the room. And then as medical professionals, we protect ourselves. So we have to wear a mask and a shield and a gown, the whole 9 yards. And then the complicated thing is what happens when a baby is born, right? Mm-hmm. Because babies don't really have good immune systems. They don't really have antibodies or those cells that fight off infection until about 6 months of age. We used to separate the moms from the babies for 14 days until the mom became asymptomatic. Now we don't really do that. We tell the mom to wear an N95 mask if they can around the baby, and we make sure that if they're breastfeeding, they cleanse the breast before they allow the baby to latch. But it's just a matter of the mom having protective equipment on while they're around their babies, because once they go home, it's very hard for us to tell moms to continue to be separated, although that's what we were doing.
Nice. Thank you.
So, Doc, has it been anything? I'm sorry, has there been anything work done on the meanness of women and doing certain things?
The meanness?
What do you mean? We're having a baby for you.
Well, this is what I tell people. My patients know, hey, you are growing life. You are growing a whole human being. That's hard work.
Yes.
And these men have to give us a pass for anything we do or we say when we are carrying this
Absolutely. And that baby is coming through a part of us. I don't even want to go there. Shut up, George.
Right. I can't.
Ladies and gentlemen, for Pregnancy Infant Loss Awareness Month is Dr. Nicole Lee Plenty. Thank you.
Thank you guys for having me.
Thank you so much.
Thank you.
Bye-bye.
Okay, bye.
Bye-bye.